Let's talk about discoloration. Now, when it comes to performing cupping, there's always going to be some degree of discoloration. We need to know the difference between what's perfect, what's okay, and what's really not ideal. So this is not okay. We do not want any of the above, these deep purple spots. We don't want to use this many cups, and it's really not at all what we're looking for. Now, within the scope of traditional Chinese medicine, something like this is acceptable, but again, that's not what we're doing. We're doing myofascial cupping as opposed to traditional Chinese medicine cupping. Color matters in this case. What the color of the tissue is telling us if we are doing a good job or not. So we absolutely have to pay attention. We aim for mild discoloration of the skin, mild being the operative word. We really do not want deep, dark discoloration. Now, if that happens, if you follow the instructions and you do as we've taught you, and you still get deep discoloration, that's not a big problem. You haven't injured the person. All of this is to say that deep discoloration is not necessary. The effects that we get with less discoloration are equal to, and in many cases better than that we get from deep discoloration. So don't dismay if you end up getting deeper, darker color, but aim for the perfect, appropriate discoloration. So colors in TCM are essentially going to indicate what's going on with qi and blood and what's going on within the vital substances within the body. And within TCM, we're instructed to learn the difference between little purple spots and big purple spots and discoloration of a variety of types. We, of course, aren't that interested in all these different varieties. We want to know the difference between too little, perfect, and too much redness or discoloration. In TCM, this has nothing to do with fascia. This has to do with internal medicine. And again, we're concerned more with what's going on with fascia. We want light discoloration, and this thing called mild petechia. Mild petechia are those little tiny microvenual damages that we can see. We want an even amount of redness. When I'm performing cupping on a large area, I like to imagine I'm painting it all the same color. It wants to be a uniform color. Now, that being said, in areas that are higher in their dysfunction, there's usually more discoloration. We want minimal bruising after treatment. Bruising is normal. It's quite typical, in fact, but we want it minimal. Most bruising should disappear within about a week. If it's taking 2 weeks or more, that's another indication that you've gone too far. Now, this is the appropriate discoloration. We see here that it's a very mild red, and we all can see that there's the appropriate amount of slight petechia. Now, what we're also looking for is a very even color. You can see that it's all about the same amount of discoloration. We've already seen images of poor discoloration, but let's take a look again. This is too dark, this is bruised, this is uncomfortable, and this particular cupping left a mark for around 3 weeks. That's way too much. So again, discoloration, typical, but we want the appropriate amount, relatively light, relatively mild in its discoloration.